Good day everyone, I am Princess May Madelo from BS1A. Today I'm going to demonstrate about heat and cold application. First, let's define heat and cold application. Hot and cold agents are applied to an area of a client's body to bring about a local or systemic change in the body temperature for various therapeutic purposes. For the heat, average kinetic energy or the energy of the motion of molecules of a material. Then for the cold, is a relative term, a material which has a relatively low temperature that is little or no warmth. The purpose of this is for heat application is to promote wound healing, to relieve discomfort, to relieve muscle tension and joint stiffness, to warm part of the body, and lastly, to reduce edema. For the cold application, first is to relieve discomfort, to limit inflammation and suppuration, to control bleeding through vasoconstriction. For the effects of heat application, first is vasodilation, decreases blood viscosity, thereby increasing rate of flow, increases tissue metabolism as increased blood supply furnishes more oxygen and carries away waste. For muscle spasm, muscle are relaxed if caused by congestion. It is relieved as circulation improves. Decreases blood pressure, softens exudates, hastens suppurative process, and lastly increases peristalsis. For the effects of cold application, first is vasoconstriction, slows down metabolism and decreases cell activity, lowers temperature, decreases pus formation and accumulation of fluid in the body tissue, increases blood pressure, and lastly is anesthetizes the part applied. For the precautions, heat application, first is heat is contraindicated in the presence of an acute inflammatory process. Heat is contraindicated in the presence of malignant tumors because of the dangers of increasing metastasis. Contraindicated for patients who are hemorrhaging since heat decreases blood clotting ability. Special care should be given for persons who are debilitated, unconscious, or insensitive or cutaneous stimulations. For the cold application, cold is contraindicated when tissues are poorly nourished and when blood circulation is poor in an area of the body. Cold is contraindicated when fluid in tissues has accumulated in an area such as following a joint sprain, since cold acts to further retard fluid absorption by minimizing blood circulation in the area. Cold is not used when muscle tension and spasms are present because cold will aggravate these conditions. And lastly, the patient's general condition should be considered before applying cold. Special precautions may need to be taken. The young and elderly are especially sensitive to cold application, as well as the weak and debilitated persons. First that I'm going to conduct is the hot water bag application. The equipment that I'm going to use is hot water bag, cover for bag, pitcher with water at the appropriate temperature, and a bath thermometer, and lastly towel. For the assessment, determine the client's ability to tolerate the therapy. Identify the conditions that might contraindicate treatment. Assess the skin area to which the heat and cold will be applied. Assess the report of discomfort. Observe the local skin area for any untoward signs. Examine the area to which the heat and cold was applied. For planning, wash your hands to prevent the transmission of microorganisms, and assemble all materials and equipment. evaluation, evaluate the client's response to the treatment. For documentation, record the size, location, and appearance of treatment area, status of pain, duration of treatment, client tolerance to treatment. For evaluation, evaluate the client's response to the treatment. For documentation, chart the following: date and time of treatment, reasons and area of application, duration and reaction if any, effect, and signature of nurse.